Hey guys, it's Dr. Mike here from Survivor. I have a really interesting case today that I just want to run by you, and I'll explain to you why it's interesting. It's not interesting because, it's something that we've never seen before. It's interesting because patients frequently ask me, what would you do if it was you? And my answer is typically, it's different, like this is what I would do. But this case, it's different because there's a difference between what I would do if it was me, or what I would do if it was my dad, or what my dad would do if it was him, and what my wife would tell me to do. What do I mean by it? So I have a patient with an elevated PSA. Whenever we send out, we had a PSA, he's 52 years old, his PSA was 3 in the 3s, which is slightly elevated for his age. So we repeated his PSA, and we sent out what's called a 4K score. His rectal exam is normal, by the way. So in other words, I feel no nodules. We sent out a 4K score, and normal for a 4K score is about 7.5%. His 4K score is 9%, which means, but what's interesting is that we always send out a regular PSA and a 4K score PSA on the same day. This time, his regular PSA is still in the 3s, but on the 4K score, his PSA is 5. His free PSA is 13%, which gives him a age-adjusted risk of having a 26.9% chance of prostate cancer, and his 4K score is 9%, which gives him a 9% chance of having an aggressive prostate cancer. So if you were 52 years old, and you had a 27% chance of prostate cancer, and a 9% chance of having an aggressive prostate cancer, what would you do? And this is the thing, is that my dad would do nothing. I would get an MRI of my prostate, and my wife would say, do a biopsy of your prostate. I think it's fascinating. We talked all about it, all of these options with the patient, and the patient decided to get the MRI of the prostate like I would do. But it's just interesting when you see so many different algorithms that you could follow for the exact same patient with the exact same disease process, that not everybody thinks the same about anything in medicine, which makes my job interesting. Okay, thanks for listening, guys.